Oh my goodness, I'm now live. Hello, hello. Oh my goodness, here I am. I think it's the first time I'm starting my own live video. I don't quite know what I'm doing, but I'm here and I'm so excited. I think Sarah's here too. Let me see if I can accept. Hey, I hit accept. Let's see. Hi all. I'm so happy to see you all here.
All right. Oh my
Oh
gosh, it's
my
working.
gosh, we
Technology.
did it! This is so exciting, Sarah. I'm so glad you're here. I'm so glad I figured out how to press all the right buttons on time.
Hey, Jen. Who said Gen X can't use technology?
Oh my gosh, and I'm so glad that everyone else is here. Sarah,
This is
you have
amazing.
you have been sending me these articles that are just blowing my mind, and it's information I feel like I need, but I know a lot of people who are on my page need, and you are the person to tell us about it. So I want to just first start by having you just introduce yourself a little bit, like tell us who you are and what we're here to talk about today, and we'll start there.
Yeah, absolutely. First of all, are you recording this so that we can post
I
it
think
later
it
also?
goes right to the feed
Does
afterwards,
it
doesn't
automatically record?
it?
Okay, now we have a tech question.
I
I just
know.
wanted
I think
to make sure because I told so many people that
that
we would
could
record
be.
it.
Well, I hold on. There's one thing right here. Let me click it. No, that's not it. I think it goes right to our feed. It doesn't. It. Oh wait, what is this? No, that's my camera.
Does IG, okay, I'm Googling.
Does anybody here in the room
Yes,
know? This is
it
so
says
fun.
yes. Okay, it says yes. Instagram automatically saves lives to your live
Okay,
archive.
good, good,
And then
good. All right, and then I'll
you
post.
can probably share it to me and then I can share it on mine as well. Okay,
Okay,
perfect.
yay. Okay, so Sarah,
Thank you,
we're here to talk
Google.
about all things hormones, all things perimenopause, menopause, the intersection
Everything.
with trauma, all of it. So tell us who you are and what your specialties are and what we're going to chat about today.
So I'm Sarah Sheely. I'm a certified nurse midwife. I'm also a mom of two amazing adult daughters. I'm also a nursing professor. And I recently completed my arduous journey through perimenopause. And I survived.
Yeah.
But along the way, and so, over my career, I have worked with women since the mid 90s. Like I've been catching babies since the mid 90s. And I worked in hospital settings, I worked in community settings, I worked in big tertiary care facilities, I worked in little small community hospitals, I've done home birth, I've done water birth. So I've spent a lot of my career, all of my career working with women.
Yeah.
And here's the thing. I have mostly been working with women of childbearing age. And so my expertise in this perimenopause, menopause stuff did not exist
Yeah.
because it's very small. The amount that you get in school is very, very small. So when I had my own journey into this realm of complete, I call it a storm cycle, like an upset, that just like the hormones are all over the place and you're all over the map. And when I entered this for myself, I went seeking help from all the people that I know. And I know a ton of people. I know doctors, I know midwives, I know nurse midwives, I know people who do holistic stuff, I know people who do mainstream stuff. And literally, I found very little satisfaction in any of the feedback or advice or support I was given, or rather not given.
Yeah. Yeah.
Very little. And even I would go, they would say, oh, well, you know what, you should go see this woman doctor because she's your age and she wants to, she wants to develop her menopause practice. Okay, great. I went to see her. Very little to offer me that was helpful.
Yeah.
And
So
so
kind of like trauma and the mental health field, right? It's sort of this thing that impacts so many people, and our training is this big. And so I'm so grateful that you felt the calling to pick up that, mantle and run with it. So, okay, so sorry to interrupt. Keep going.
Yeah, so literally what I did is I went, I Googled it and I went online and I found the North American Menopause Society, which is they're now doing a rebrand to be called the Menopause Society.
Okay.
And I ordered the clinician's guidebook because like one of the things about being a nurse and a nurse midwife, and of course any kind of a practitioner, is that we're lifelong learners.
Yep.
We're curious. And so we're curious to figure this out. If you have people coming to us who have some that present, with something unique or interesting, then we like dive in and want to figure it out and, see what's out there, who's written about this before, what do we know, what don't we know, how can we, sort of tailor this to individualize it to our person who's sitting in front of us.
Yeah.
So basically I was like, did it for myself, right? I like read the entire clinician's guidebook. And then I just started pulling all the articles from there's so many new articles about perimenopause, menopause, the understanding of the intersection of inflammation, stress, cortisol, the HPA axis, like all these things are all connected. So as I went in and kind of dove into my own situation, once I read through all the things, I was like, well, I might as well take this test, because look at how many women are out here. If me with all my access and insurance and education and network couldn't get what I needed, how is it for everyone else, right?
Yeah.
And so that's when I decided to shift into doing this as my full-time gig, because I love women of our age. Like, I'm obsessed with us. We have learned so much, right? We have lived through and survived like so much stuff.
Yeah.
And I'm getting hot. So and I just like I feel like we have so many gifts to offer to the world, and so many of us are suffering because I see women, and I've heard stories, people quitting their jobs, right?
Yeah.
People downsizing their jobs because they feel like they can't function.
Yeah.
People getting divorced. Maybe that's a good thing sometimes, but maybe not.
Right.
Maybe, right? Maybe not. And it's just like, you know what? If we can sort of get people onto, my fantasy, right, is that we catch women in their 40s, like even in their late 30s, and we educate them about what's all this that's like on the horizon, and how can you set yourself up for success, so that because it's inevitable, right? We can't not go through it. Like, it's going to come. But if we can set ourselves up beforehand to be kind of resourced and resilient, I think my suspicion is that we can prevent a lot of suffering. Yeah.
You're so right, because, here I am sort of navigating this for the first time. And, I like to think I know a thing or two about a thing or two, and I know nothing about this, okay? And nor do my friends, nor do my clients. And we're turning to each other going, you know what? I think I need to go get a test for my hormones to see where I am. And, in my work with you and then talking to someone, it's like, that's not a thing, but that's what I've been told. It's sort of like, when you feel that you're at a certain age, or maybe you're having some symptoms, that you're going to go and get some test that's going to tell you that you've entered into some phase. And that's really not true. And could you tell us why, like what is true?
Yeah, it's so confusing. So here's the first thing, right, is that, first of all, perimenopause in and of itself is so confusing for a few reasons. One is it's different for everybody. Okay, so like what happened for your mother or your cousin or your sister or your girlfriend is not necessarily what it's going to be for you. So that's number one, confusing, because literally there's more than 60 symptoms, and you're just going to get your own little curated list of what's on there, right? And not everybody gets vasomotor symptoms. Vasomotor symptoms are your typical hot flashes and night sweats. And that's sort of the most easily understood, like, oh, that's perimenopause. But not everybody gets that. So, but everybody will get something. Okay. And the most common ones are those vasomotor symptoms, but also sleep disturbances. And honestly, I haven't met any woman of our age range that doesn't have sleep disturbances. Anxiety, panic, heart palpitations, all the crazy stuff that's going on with our skin, all the things that dry up, everything dries up. You know, so everybody gets, you know, these little curated lists. So
Yeah.
that's one confusing
Yeah.
thing. And then somebody, and here's the reason why this happened, is that you think, oh, I have to go get something tested.
Right.
So that comes out of what historically has happened for us in the United States, which is that way back in 2001, there was a big study that got publicized that at this point now in 2024, it's been completely debunked.
Yeah.
But the way that they wrote that study, the way they publicized that study, resulted in everyone getting off hormones,
Yeah.
removing menopause at all from medical curriculum, nursing curriculum. Nobody learned anything about it. And basically, all of medicine from that point on learned just tell women hormones are dangerous. So we now know,
Yeah.
with all the data that we have since then, and in particular the last couple of years, there's really been a big push by some of the biggest researchers to really be clear that all of the, pretty much all of that data is like just completely not accurate.
It's so
And
heartbreaking.
and it's for a number of different reasons. But then what happened, if we understand that history, you know, dictates how we got here today,
Yeah.
what happened is that, of course, women continued to go through menopause and feel terrible and need support.
Yeah.
And so this whole industry came up out of that, like out of a you know, need,
Yeah.
right? And what happened is that it kind of came into the realm of naturopathy and holistic
Mm-hmm.
medicine. And at that time, their thinking and the philosophy behind it is that we have to test everything because it's kind of how that kind of medicine works,
Mm-hmm.
is that they want to test everything and they want to replete things that are depleted,
Yeah.
which is not a wrong way to think. It's just a
Sure.
different way to think.
Yeah.
But the reason this doesn't apply for us in perimenopause is
Mm-hmm.
because perimenopause is a storm cycle. And during a storm cycle, our estrogen is up and then it's all the way down, and then it's up and it's all the way down. It's up and it's down. Same with our progesterone. And so instead of having our regular, nice, like regular 2 bumps per month
Yeah.
that we did in our reproductive
Mm-hmm.
years, right? That we
Mm-hmm.
could kind of start to track and become familiar with. And what I love is that we see this younger generation really getting in touch with their cycles, right?
Yeah.
I love it. I love it because my hope is that then they will actually be able to navigate perimenopause in a more connected, embodied way because they're
Yeah.
more connected with what's happening in their
That's
bodies,
right.
right?
Yeah.
So for us in perimenopause, there's no reason to test because a test who it doesn't mean anything. If I test
Yeah.
today a woman in perimenopause, maybe her estrogen is through the roof and maybe her progesterone's in the basement, but I can't do anything with that because tomorrow if I test
Right.
her, it might be the opposite.
Makes so much
So
sense. Yeah.
it doesn't make any sense to do any hormone testing
Mm-hmm.
to see am I in perimenopause. And in fact, the Menopause Society guidelines, they say do not, like it is not indicated. We don't do testing to diagnose perimenopause. We do a symptom questionnaire.
Uh-huh.
So, you know, we do a symptom questionnaire. And that's like, you actually can even just Google menopause symptom
That's
questionnaire
amazing.
and find it
Mm-hmm.
yourself, right?
Mm-hmm. Yeah.
Yeah. So it doesn't mean that there's no use at all to testing, but you don't really need to do it to start treating someone for perimenopause.
Right.
Yeah.
Okay. Oh, that alone is just so helpful, right? Because it also just felt like a barrier, like, oh, when am I going to get in to see the doctor? And then it's like, well, do I really want to be in perimenopause? And so I push it off, push it off. And then one day you're just like, what is happening in my body? What is going on? And so
Right?
when you talk about that feeling of, hopefully this early education and greater connection in our bodies. And that's also a lot of what we talk about in trauma work too, is in
Yeah.
terms of being present and knowing what regulation means,
Yes.
that hopefully folks that are a little bit younger are going to have an easier transition. But for those of us that are here now, what would you like to impart today? Like what are the big nuggets that you want people to know about that are in perimenopause or in menopause even?
Yeah. Well, I'd say one of the biggest things that I want to impart is to give you hope,
Mm.
right? Is to really give you hope that you can feel better. And a lot of times we don't even realize how bad we're feeling until we really start to feel
Yes.
better. Because as women, we're so used to just handling all the things and holding all the things and juggling all the things. And so it's important to understand that when you start to feel like you have less ability to do that,
right,
that also may be an important sign of estrogen deficiency. Because one of the great things about estrogen, right, is that it gives us this like resilience to stress. And so when we're thinking about this whole perimenopause, menopause transition, the most important concept to kind of grasp onto and then to sort of circle around is that overall, estrogen, progesterone, testosterone, these three important hormones, they're all very important anti-inflammatory hormones.
okay.
And so when we lose them, our inflammation in the entire system goes up. And so what we know about inflammation in the brain, right, is that neuroinflammation is a driving force in postpartum depression, in anxiety, in sleep disturbances, and in menopausal related depression. So estrogen affects the neurotransmitter pathways, right? And so when we're talking about dopamine, serotonin, right? These are important neurotransmitters that help us to feel good and have resilience, right?
Yeah.
When we're losing estrogen, we're losing kind of a precursor to these important neurotransmitters. And that's why we're more at risk during these times of low hormones.
Yeah.
So there's a real similarity between postpartum, right? Because in postpartum, after you deliver that placenta, your hormones drop off because your placenta became your hormone factory, and your own endogenous hormone sort of production hasn't really fully come back online for a while, right? And if we're lucky enough to get the hang of breastfeeding, then we get some support from the oxytocin and the prolactin related to breastfeeding, because it's pulsatile, and every time we bring the baby to the breast, we get these little, we get these little hits of these important neurotransmitters, right, that help us to feel good and happy and at peace and love our babies and all that.
Yeah.
So now in perimenopause, there's no like reward of a baby, right? In fact, for many women going through perimenopause, they may already have been depleted from a postpartum that wasn't really attended to. And they often have children who are going through their own hormonal transition at menarche.
Wow.
These are the women I really, really, really feel for, because it's just total chaos in that household. And it's like, how am I just going to hold it together?
Sarah, it's so much to navigate. Yeah, I'm feeling that. So, okay, give me, generally speaking, I know it's so unique, but what age ranges are we talking about here? When do we need to start thinking about this kind of stuff?
So, I mean, I would say literally in the mid 30s, we start thinking about it, because we remember that perimenopause can last 2 to 12 years. 12 years. Okay. So the average age of menopause is 51.
Okay.
But menopause itself just means that you've had 12 months no bleeding.
Yeah.
Okay. That's all it means. You could have been in perimenopause for 10 or 12 years prior to that.
Wow.
Which is kind of crazy.
That is a long time.
It's a long time. It's a long time. And we can't change that, right? Like, there's nothing that we can do to change how long a person's perimenopause is. And so that's why holding on to that concept of inflammation as the driver of so many of the discomforts can help us to understand, like, what are the other things that we can do and need to do to feel better, right? And so definitely menopausal hormone therapy plays a very important role, and I am really an advocate of women considering that for themselves
Mhm.
because not only will it help you to feel better, sleep better, be less anxious, but importantly, it really helps with your bone density, to maintain your bone
Wow.
density as you go through this transition. It really helps to prevent dementia and Alzheimer's,
Wow.
and it really helps to protect you against heart disease. And so these are lifelong, this is kind
Oh.
of like we get to decide, like, how are we going to take care of ourselves now? It's
Mhm.
going to determine how we live, how we feel, how we, embrace life, like, right, for the next chapter, whatever that is, 20, 30, 40 years, however long we have,
Yeah.
right?
Yeah.
But the inflammation piece is important to understand. And I think there's a lot more in sort of the common communications these days about inflammation. There's a lot of misinformation too, but generally we do know that there's a couple things that really help fight inflammation. Number one, stress reduction.
Mm.
And it's like we get told that over and over, and it's almost stressful to like hear, just reduce my
I
stress.
know.
Okay, but you know what? It's all about nervous system regulation,
Yeah.
and that's a skill, and we can learn it. And we just, so I'm sure you do this with your clients all the time and probably have some really simple, basic things, but I will sometimes just teach people how to do just very simple, like box breathing, like just basic breathing. And when we think about nervous system sort of regulation, it needs to become a habit
Yes.
that we do small things every day,
Mhm.
frequently, right? Whether it's breathing or saying something nice to yourself or when you look in the mirror, all those things we can do. So we
Yeah.
can learn that nervous system regulation. And then the other things I love are like acupuncture, and then of course exercise. Like we know that exercise is like as good for many people as like an SSRI,
I know.
for a
Yeah.
dopamine booster, right?
Yeah.
Now, in this time of life, the exercise needs to shift a little bit, and we actually need to do more weightlifting, strength training. And
Mm.
that's at least twice a week. And it's very important because the way that when we lose estrogen, the body composition changes.
Mhm.
And so this is like the pain point for a lot of people, is like, where did this belly fat
Yeah.
come from? Like, I can't, like, why can't I hold on to my muscle? It's because your composition has changed because you've lost estrogen. So, and your testosterone is dropping. So these are things that when we lift weights,
Yeah.
we can actually reverse that and hold on to our skeletal muscle. And on top of that, we just need to move. Like we need to move a lot, like every day moving, and at least twice a week lifting actual weights, right?
Wow. Okay. This is big. I'm hearing it. I'm going to
Yeah,
replay when we're done and listen again because I think it's hard. I think also with the sleep disturbance right now, I'm exhausted and I don't
yep,
have as much energy to get out the
yep,
door and to do it. I really struggle with that and with food, with
right,
dietary stuff that would be more helpful. What's good
right.
in terms of reducing inflammation with diet?
So we have really good evidence about the Mediterranean diet. Like it's, if you Google the Mediterranean diet evidence, there's like that and the DASH. There's one that's called the DASH diet, which is like a diet that was created for heart disease patients. But basically, the Mediterranean diet is like high in fiber,
Mm-hmm.
high. It's whole foods. It's high in smart proteins, a lot of fish, right? And then olives, olive oil, lots of veggies, fruits, right? And so it's basically like, look, you don't want to, if you're starting from a place where you have a lot of processed food in your regular day to day, you can start by like, let's try and like diminish that a little bit, and
Yeah.
then let's try and do some more home cooked, whole foods. And there's a lot of great resources for that everywhere, but that's the Mediterranean diet is your premier anti-inflammatory diet. You can also think about like an Asian diet, like a Japanese diet, like where the blue zones, right? The
Yeah.
blue zones are mostly eating lots of high quality protein, they're also eating a lot of superfoods, right?
Mm.
So they're eating these foods that are rich in all the micronutrients, and they're also often eating fermented things. And so when we think about food, it's not only what's going in, but it's like, how are we caring for the gut health?
Mm.
And so gut health actually changes when we lose estrogen. Our microbiome inside of our gut changes. And so a lot of women show up in perimenopause starting to have like gut issues that they never had before. They start having constipation, or in the other direction, IBS. You know, they just start having upset in the gut, a lot of gas, right? And it's because actually the microbiome has changed when we lose estrogen. Yeah, it's crazy. But then we also know that the gut that's where our immune system resides, and that's also where our connection to the neurotransmitters and, you know, like brain health all resides with the gut. It all goes together.
It's all connected.
Yeah.
Yeah. And then, so you were also sharing with me this, you know, if you have a high ACEs score, a history of trauma, and you're already carrying all this inflammation, of course, there's going to be an impact during this
Yeah.
time of life, which just was so sort of, you know, it was good to read, but hard to read at the same time. It's like, okay, one more symptom that we have to think about in terms of, you know, carrying the complex unresolved trauma that we still have in our bodies. So
Yeah.
can you tell me a little bit about that? I think it was related specifically to brain fog and things like that.
So I would say, you know, when I read an article like
Yeah.
that, and I sent it to you because that's your area of expertise. But I also, when I read an article like that, I'm like, I feel like I put it in the category of like, yeah, thanks, Dr. Obvious.
Yeah.
You know what I mean?
Right.
It's the same like when I read an article about like putting babies skin to skin helps to regulate their temperature and heart rate. And it's like, duh.
Yeah.
So, you know, of course, people who are walking around with trauma,
Yeah.
from whatever source that is, be it childhood or PTSD or whatever,
Yeah.
right?
Yes.
Of course, their brain chemistry has changed.
Yeah.
And the way that their nervous system interacts with the environment is different.
Yes.
And they're more sensitive, and they're more easily dysregulated.
Yes.
Right?
Yes.
And it requires like a big lift for folks carrying trauma to like make sure that they feel safe and okay.
Yeah.
Right?
Yeah.
So now we're going to layer on top of that the sort of inherently inflammatory condition
Right.
of hypoestrogen. Like we're going to drop these three important hormones. Like we're going to drop them first, we're going to put them in a storm, and then we're going to drop them out completely all together, right? And so then you take that, right, and you combine that with the fact that the medical community by and large doesn't really have an expertise around menopause right now. Nor do they really have an expertise about complex trauma.
Right. Yeah.
Nor do they have an expertise about women. So, you know, like this, and I really think that like this is why, you know, it's people like you, people like me, people like there's a woman in the UK writing a book because so in the UK things are very different, and they're like all in on menopausal hormone therapy. But like anything, the pendulum has kind of swung a little too far. And now there's recently been some things about people getting over prescribed hormones, like getting too many hormones in too high a dose. And the reality is there's no actual guideline for dosing because there's no data.
Oh my word.
Right? So in a way, everyone is a little bit like, you know, flying a little bit blind. But at the same time, like for me as a clinician, the way I think about it is I know what's a safe dose, and then I'm really connecting with my patients to help them discover their intuitive knowing about their bodies. And to really work with me on the titration of the various hormones so that they can get what is the right dose for them and the right blend. Because they come in a lot of different forms, and it's different, like the way that people respond to the different forms of hormones are really individual. So, you know, for me, when I read an article like this helps to sort of validate for me that it's actually really important that I ask about trauma
yes,
history.
right. Mm-hmm.
Because I also see that if someone has had a postpartum depression
Mm-hmm.
or a traumatic birth
Yeah.
experience, this is also a time when, look, we get an opportunity, right? And our life continues to give us these opportunities to heal and
Mm-hmm.
to work through our stuff, right? And it's kind of like it's a rite of
Yeah.
passage, and we're getting pulled through it. We didn't ask for it.
Yeah.
I have a question. Would you love to have your hormones go bananas for, I don't know, 2 to 10 years? Sound good to you? Sign me up. No, none of us asked for this, but it's inevitable. It happens. And what we can learn from it is okay, gosh, this life, if I am, and honestly, right, if I am fortunate enough to still be here
Mm.
alive in this lifetime right now,
Yeah.
at this age,
Yeah.
then I have to figure it out. I have to figure out what I need to do and how I need to do it to feel good so that I can be the loving, kind, generous, generative person
Yeah.
that I want to be.
So you
And
are here to help us figure it out. And so for the people that maybe have just joined, I just want to say again, you are Sarah Sheely. You are a midwife. You've long delivered babies in LA. You've caught half of the babies in this town. And now you're specializing your practice. It's a new practice that you've started that really is focusing on this time of life, perimenopause and menopause. And so if people aren't already following your page, I encourage them to do that, because I feel like you are providing really, I trust you so much. I know that if you are posting something, that I can trust it. And so I hope that people will follow you. You also do have a practice that's online, and people can certainly reach out to you in terms of consultations, because you are, like you said, really following people as individuals and taking thorough histories and monitoring and helping, taking their hand as they walk through this phase. But I'm also curious what you would suggest for folks that are looking maybe for someone in their town, or that, how do they know that who do they even ask? Do they go to their general practitioner? Are they going to the person who delivered their children if they have kids? Who are they asking, and what are they
yeah.
asking?
So I really, first of all, just appreciate your endorsement like that. It's very sweet. Thank you. Yeah. And, we have known each other for a long time, and it really means a lot to me. So I can see people who are in California. I have a telehealth practice that is California only. That's the law. That I can't really see people who don't live in California. But if you don't live in California, you can go to menopause.org, and that is the Menopause Society website.
Mm-hmm.
And I would look specifically for someone who's not only a member of menopause.org, but who's actually certified.
Okay.
Because being certified means that you have taken the exam, and then you have continued to do education to stay current. It's it's pretty rigorous. And that's going to be your person who's most up to date with hormones.
Okay.
And hopefully all the things, right?
Yeah.
Because it varies. People will go to their regular practitioner, and some practitioners will be up to date and some will not. Unfortunately, just because someone delivered your babies doesn't mean that they know anything about perimenopause, unfortunately. So, the kinds of things that I hear women, come and have said, and you can look online for gaslighting things that people have heard, from their providers. It's really a time. I think I'm really curious to see what happens over the next 10 years, because I think it's really a time where, especially because we have social media, especially because there are so many of us of this generation who are doing this work. And so there are some really great folks to follow on Instagram and TikTok who are also really providing really solid information. And I'll put a post up, and I can send it to you too, of just kind of my top 5, folks who are doing this work. And you can really learn a lot just from like going back and watching, watching them. There's a couple in particular who really talk a lot very specifically about, like even as a provider, as I was studying for my exam,
Yeah.
my certification exam, I learned so much just like, watching their posts
Mhm.
on reels and stuff. Um, so, I mean, it can be hard. And I think that one of the things is that when you go and you talk to your provider, what could be helpful is if you take, get one of these menopause symptoms
Yeah.
questionnaires, right?
Okay.
And then you take the evidence, right? You fill it out and you take and you say, look, I have 15 of these things that are related to perimenopause. But you have to also say, I'm really suffering.
Yeah.
Like you have to kind of, we have to learn how to advocate for ourselves in the medical system, and say, I'm really suffering, with all these things. And, I've tried. And, there are some basic things that you can certainly try, especially at the beginning of perimenopause, that will help you to feel better, sleep better, all those things
Mm.
before you need, hormone therapy. And so I also work with people around that. But I think,
Yeah.
if you're before this phase, if you're not there yet, then what you can do is like get your nutrition figured out,
Mm.
right? Get on an anti-inflammatory nutrition, you know, and it's not even like a plan or a diet. I hate those words. It's like a habit. It's like how you live your life,
Yeah.
right? Get in a movement habit, right? Move, move, move. Find what you love to do for movement. I don't care if it's Pilates or yoga or dance or walking or whatever, and do that a lot. And then add 2 days of lifting weights, no matter what you're doing. Okay. The other days you go and you live your life, you have a great time. Get your girlfriends together, talk about this stuff, right?
Yeah.
Community,
Yeah.
because just community is a stress reducer, right?
True.
And so then, at some point, most people will feel much better once they get on some kind of hormone therapy. But it's not the only thing. It's just one piece of this whole puzzle, right?
Yeah.
Yeah.
Yeah. Well, I love just the recommendation to go and look at the questionnaire. And even though you're saying, of course there's a correlation between inflammation as a, trauma survivor and what happens in perimenopause, I wouldn't connect those dots because part of my experience of being a trauma survivor is that, oh no, it's just me. It must be I'm doing something wrong. I'm broken. I better stand up and learn how to fix it, right? And so if I'm looking at this questionnaire, I can sort of, and you see how these things are hanging together, it starts to be a bridge. It starts to give a little more information to sort of, yeah, make it not our fault, right? I think that that's like
Oh, yeah.
such a common experience of people that I work with. Like, it must just be me. And especially because a lot of my symptoms don't really seem to fit that classic pattern. I haven't had a night sweat. I haven't had a hot flash. But my anxiety spiked. My rage suddenly went through
Oh,
the roof.
yeah. Rage.
I told
Yeah.
you that there was a time where I literally had to tell my husband and my son one weekend, you guys need to leave me alone. Go into I had to sequester myself to keep myself safe and them safe, right? Like, it was horrifying and scary and terrifying. I don't know that I necessarily put it in the context of this whole
Yeah.
fluctuation, but when you explain to me how what happens with the fluctuation when one is going up and one is going down, and the storm, like you said, that it creates in our bodies,
Yeah.
just like anything else, I could then make sense to myself. I didn't feel like I was losing my mind. I felt like, okay, this is a part of this experience. Now, how do I honor that and give myself tools to navigate it? And
Yeah.
so incredible with that. And I saw too someone who had said something about anxiety, right? Like, I felt this just, it was really like a biological, physical anxiety. I'm so analytical. I'm always looking for like the reason, and I couldn't even find a reason. And I thought, there is just something going on. This is not grounded in anything that's happening in my life. This is just happening in my body. And so
Yeah.
being able to see all of the different ways that it might present feels really helpful.
Yeah. I also I mean, I've never really been an anxious person.
Yeah.
And then when I started going through perimenopause, I was like, what is this feeling?
What is
Like, I felt like a jumpy, and then the anger, like the anger and the irritation,
Yes.
and do you really have to chew like that? Like really, you know, just like those little things, like just,
Yeah.
it was, and then, you know, once I got organized on my hormones you know, like I was like, oh, okay, so that's not just like me. It's not me that is broken.
Right.
And I think there's a really great, like if there's one thing, you know, often it also shows up in the bedroom, right?
Uh-huh.
So a lot of folks are just like happening, that they are just like, you know, lose interest, response just like disappears, can't get to the orgasm,
Mm.
you know, and that's also very common, you know, related to loss of estrogen, loss of testosterone.
Yeah.
So there's a great book called You Are Not Broken
Oh,
by Kelly Casperson.
okay.
She is a Eurogyne doc who's doing a ton of stuff around menopause, and she's got a great podcast. Um, oh, someone in here says, this is not something happening in my life, it's happening in my body.
Yeah.
Yeah, it's a great way to sort of frame it.
Mm.
But it's tricky, right? Because as women, like we're so used to having crazy shit go on in our bodies and have to still, you know, soldier on, right?
Yeah. Oh, suck it up. Better figure out how to
Yeah,
navigate, and often navigate it by ourselves, which is
yeah,
why I think it is heartbreaking that we receive such poor information to no information.
yeah,
But I'm so grateful for people like you that are like, enough is
yeah.
enough, right? Like half the
Let's,
population is going through this and no one's been talking about it.
yeah, let's
And
talk about
quite frankly,
it.
it's kicked my butt, right? And that was really surprising too. So what else, just why we're here today, and then I'm going to just give an opportunity maybe for one or two quick questions for the folks that are here. But like, what did we not say that we want to make sure that we say?
I I think what's really important, and the reading that I've been doing lately is about like neurospicy, right? Our our friends and those of us who maybe ADHD or undiagnosed ADHD, or you know, some of the articles that I've been reading about is like mothers taking their children in for their ADHD screenings and you know, treatment, and then like asking, is there an adult, you know, questionnaire I could fill out, right?
Yeah,
And so as women, I think there's a huge population of women who are ADHD or undiagnosed ADHD, and we have to also remember that this is a slightly different kind of brain also.
yeah,
And so in the hormonal transitions, including, right, adolescence,
mm,
reproduction, postpartum, and certainly perimenopause, menopause,
mhm,
anyone who's walking around with a spicy brain
yeah,
is going to have more vulnerability
mhm,
during these transitional times, more vulnerability to the hormonal shifting that's happening.
yeah,
And we have to take that all into consideration, because these are folks that would really should be co-managed, right? Like I'm not a therapist. I'm not gonna manage someone's, you know, ADHD or any other kind of mental health
sure,
diagnosis,
yeah,
but I'm gonna help them manage hormones.
mhm,
And this kind of collaboration is really, I think, crucial for all of our kinds of patients that are walking around with these extra vulnerabilities.
yes. I think the collaboration piece is so important because I think, you know, a lot of times too in mental health, we just go, oh, you know, do I need an antidepressant? And I'm not saying they might not need an
Right.
antidepressant, but certainly hormones could be playing a big part. And if you're not looking at the big picture, and I think having, you know, informed providers on either end is obviously the ideal, but part of
Yeah.
what we're trying to do here is just sort of educate consumers generally so that we can ask better questions and find better providers, you know, better educated
Yeah.
providers.
I see so many people who come already on an SSRI because that's what their doc is most comfortable to give
Yeah,
them. But I want to really encourage folks that if they have a new onset, so like if you've never been anxious or depressed,
yeah,
and it's a new onset in this sort of time frame of late 30s in throughout the 40s,
yeah,
you really deserve to have a shared decision making
yeah,
conversation about menopause hormone
yeah,
therapy. And I think that's the key. Like for me, because of my background as a nurse midwife,
Mm-hmm.
working with people who choose all different possible ways of birthing
Mm-hmm.
babies, one of my closely held philosophies is shared decision making is the most important thing,
Mm-hmm.
because I'm not attached to, like I'm not delivering babies anymore, but like if, I'm not attached, like if you want to have a scheduled C-section, you want to have an epidural, you want to
Right.
have a water birth, you want to have hypnobirth, no one's going to talk. I don't care.
Yeah.
I'm going to help you get what you want in the most sort of connected, loving way so that you and your partner, whoever is in your family,
Mm-hmm.
can navigate that in the most possible, the healthiest, most sweet, loving, connected way so that you can have a good postpartum.
Yeah.
That's always like as a
Yeah.
midwife. So now that I'm in this
Yeah.
realm, shared decision making is so important because we as women have been infantilized by the medical community
Yeah.
forever. Like I'll just tell you what to do.
Yeah.
But we also have been acculturated to it. I'll just trust my doctor. Well, you know what? No one's coming to save us.
That's right.
We are here to save ourselves. And so we need to, my goal as a provider is really to like help women figure out what is the best thing
Yeah.
for them,
Yeah.
right?
Yes.
And when to start it and how to titrate it and what to add or take
Yeah.
away so that they can feel great. Because you know what? Who's the expert in your body? You,
That's right. I love
right? Like,
that. It's so important.
right? Like, it's like not that complicated.
Yeah, and that even if someone is the expert, we're allowed to like push back and ask all the questions and advocate for ourselves. That's just true across the board, and so many of us were not taught that we could do that.
We could probably do a whole
I know,
another session on
just
like
on that.
empowering, but I mean, it's
I
important, right? Like,
know it's so
how
important.
do you speak up for yourself in that exam room?
Yeah.
And you have to also have compassion for providers because in reality, your mainstream medical provider has, you might have 15 or maybe even 10 minutes on their schedule.
Ugh.
So you have to be realistic about what they're trying
Right.
to do. You're not going to get a full menopause consult in
No.
10 or 15
No.
minutes. It's just not going to happen.
Yeah.
So,
Yeah.
you have to
It's
be
also
realistic.
I think what you're offering is so incredible that your appointments are always an hour and you're looking at the big picture, the whole person, and really taking their hand. But I know a couple people have asked, so maybe we'll just start with that
Yeah,
question.
let's see what questions we have.
Well, a couple people I've seen, they're asking about hormone replacement in your 60s. Like when you're in menopause, would you say that that's still the recommendation? Like how do you differentiate what's useful in perimenopause and menopause?
So here's the thing. The data, there's like a lot of missing data, right?
Okay.
And so in a lot of these questions, we don't necessarily have enough evidence to say like, oh, 100% this or that.
Yeah.
And that's where we really go to individualized shared decision
Yeah.
making, a visit that really looks together at your history, your risk factors, your whole situation, how you're feeling. And that's something that should be done with a menopause certified specialist
Okay.
who can really help you tease out what are all of the different pieces to
Yeah.
this and what do they all
Yeah.
mean. Yeah.
Yeah. So similar answer then. It's really so personalized, but ask the questions, get the answers. Yeah.
We certainly know that even a very, very low dose of estrogen, estradiol, is
Mm-hmm.
important for protecting bones and preventing osteoporosis.
Wow.
And so, we know that the benefits continue even beyond.
Mm-hmm.
But as far as like, what does the evidence say about starting later when you're
Yeah.
more than 10 years beyond? We don't have
We don't.
strong evidence. But that doesn't mean that we don't do it,
Mm-hmm.
depending on the person and the situation.
So someone said, how do I tell on menopause.org if the practitioner is certified?
I know. So they're honestly, their website is a little bit dated, and they are updating it.
Oh.
I know. But you kind of do have to search. So you can search by your state,
Mm-hmm.
and so I would start there because many folks that are doing menopause care do telehealth, and telehealth generally you need to be in that state to access that telehealth provider who's in the same state as you, but they don't necessarily have to be in the same town. So I would first filter your search by state, and then you'll see in the directory that it will have the people who are certified have a MSCP, which is Menopause Society Certified Practitioner.
Mm-hmm.
Those 4 letters after their name, that will be a certified practitioner.
Okay.
Now you could also, the fact that somebody is a member of menopause.org means that they care and they're paying attention. And to be clear, a provider doesn't need to get certified in menopause to be able to do menopause care. But if they're really focusing their practice on menopause care, they should be certified, because the reality is there's so much new information. I'm literally every single day reading articles to stay up to date.
Yeah.
And so somebody that they're, you have to think about what's their, go to their website and look at what is the focus of their practice. If their practice is focused on, delivering babies, they may not, there's so much to know and learn and stay up to date with delivering babies that, they're focused on that. So, you really want to look for someone that has a menopause focus.
Yeah.
There's a great new book that's coming out any minute. It's called The New Menopause.
Wow.
And it's this Dr. Mary Claire Haver in Texas, who's also our same age, who got activated about all of this. And she's sort of the social media menopause queen. And I bow to her because her stuff is amazing. It's very evidence-based. It's very easy to understand, very accessible.
Right.
So her new book is coming out any minute. And then there's also a new book that just came out by Lisa Mosconi, and she is a neuroscientist, an Italian neuroscientist. And she is the first person to put women into the brain scanner and look at the scans of the premenopause and the postmenopause brain, and then to really be able to explain easily, in an easily understood way. So hers is called The Menopause Brain. Okay. She also has a previous book called The XX Brain, which talks about women's brains and the changes that our brains go through when we go through postpartum and, adolescence and all of the things. So there's some really solid, accessible information that is out there and coming out, and everyone is talking about it a lot more. I'm excited for the next generation, right? What they'll be able to learn and know, and hopefully not suffer so much. Yeah.
Exactly. Well, thank you so much, Sarah. Everyone who's here, or if you're
Thanks everybody for coming.
Be sure to follow Sarah. What's the best way to reach out to you? Is it DM, through your website? How do people contact you?
So if people want to see me as a practitioner, they can go to my website, and that's also linked in through my bio on Instagram. Yeah.
Excellent.
Yeah.
Thank you for everything.
Yes.
We'll have to keep doing this. I feel like everything.
I know.
So quickly. This is so helpful. Thanks everyone for being here, and I'll.
Good. All right, everybody, take care.
Okay. Bye.